Hi, my name is Mathieu Rousset. I've been an implantologist for 15 years in central France in Brive. I've been working with Domaine Medical since the beginning of my activity, and I've been lucky for several years to participate in the development of certain products like CAD/CAM abutment, guided surgery, and now the new implant, the Nevo. I have a private practice with an implantology education center. In my daily practice, I use for each patient digital tools like CBCT, intraoral scanner, guided surgery, photogrammetry, face scan, 3D printer. I will share with you two cases in which I use digital tool and the contribution of the Nevo implant in these protocols. First of all, we will treat a patient wanting a maxillary rehabilitation. He has been wearing a removable prothèse for many years and wanted a fixed solution. After various proposals, the patient opted for an all-on-6 with immediate implant loading. As you can see, the patient still has 4 teeth that will have to be extracted during the surgery. A quick first surgical planning is carried out in Carestream PDAP software to show the patient. Then the fields will send to the prosthetist so that he can design the surgical guide. The prosthetist will provide a stackable guide divided in 3 parts: a position guide, a base guide, and a drilling guide. First of all, we position the base guide using the position guide. In this case, the base guide is stabilized using 4 anchor pins. The flap is made and the teeth are extracted. In this situation, we don't carry out the full drilling protocol in extraction socket in order to improve the implant stability. The thread design allows under-drilling while respecting the surrounding bone. Once all the drilling is done, the implants are screwed through the guide. The Nevo provides a lot of comfort in this kind of case. The tapered design provides high primary stability. The progressive thread design protects the surrounding bone. The super hydrophilic surface provides fast healing. That's why we call it the gentle implant. As you can see, at the level of 13, the implant is positioned in an extraction socket. The bone's quality is poor, but they still manage to get an EISQ of 73. Then we set up the variomulti abutment. The 2 posterior abutments are angled at 17. The scan body are screwed and the optical impression can be made after grafting in the defect using sticky bone. As you can see on the STL file, the basic guide is kept for the realization of the impression. It allows the prosthetist to reposition the model in the 3 planes of the space. Then we will use photogrammetry because the accuracy of the optical impression is not sufficient to create an implant-supported bridge of this size. With this kind of technology, which is an extraoral scanner, we get an accuracy less than 50 microns, which allow a passive adaptation of the framework. All the data is sent to the prosthetist at the end of the morning. It takes him less than an hour to design the temporary bridge. The bridge is printed chairside. The patient is called back at the afternoon to install his bridge. The X-ray control shows a good bone level. In conclusion, the Nevo enable us to secure our immediate loading protocol thanks to an excellent primary stability without damaging the surrounding bone. After 3 months, we can see a good cicatrization, healthy tissue, and on the X-ray you can see the good position of the bone. But the implant can also be used in situations where the bone density is high. I will quickly show you a case of an all-on-4 in mandibular with a bone type 1. The patient had no teeth, so we made a dual scan with radio-opaque devices. Stackable guides are made by the prosthesist as in the previous case. The only thing that will change is the drilling protocol. In this case, it's essential to carry out the full drilling protocol. Implants mustn't be too compressive on the surrounding bone. The implants are screwed through the bridge. We made the optical impression, then the photogrammetry. The temporary bridge is fitting in our office. The patient is called again at the end of the afternoon in order to screw the bridge. That's the clinical situation in the evening. The X-ray control. At the healing control, after 3 months, we can see ideal bone level that prove that despite the apparent aggressiveness of the implant, the Nevo makes it possible to increase the primary stability of the implant while respecting the surrounding bone. This implant meets all kinds of indication. It's really a gentle implant.